Welcome to the Nurse Edu Network. My name is Janae. In this video, I will review practice test questions for Domain 2, facilitate learner development and socialization for the Certified Nurse Educator exam. All of the following are true about socializing into the role of a nurse except A, it should be complete by the time the student graduates, B, involves acquiring the skills and knowledge of being a nurse, C, learn to follow the accepted attitudes and behaviors of the nursing profession, D, accepted into profession by others. The answer is A. It should be complete by the time the student graduates. Nurses are continuously going through the process of socialization. Which learning strategy involves the cognitive domain? A, practicing hand washing. B, student reflecting on their views of vaccination. C, practicing IV insertion in the simulation lab. D, creating a concept map to explain the pathophysiology of diabetes type 1. The answer is D, creating a concept map to explain the pathophysiology of diabetes type 1. The cognitive domain is the thinking domain. Answer A and C are both from the psychomotor domain. Answer B is from the affective domain. What learning style can be challenging to teach because they prefer new experiences? A, converger. B, assimilator. C, accommodator. D, diverger. The answer is C, the accommodator. The accommodator combines concrete experiences and active experimentation. They are risk takers and prefer hands-on experiences. They prefer gut feelings over logic. They enjoy role-playing, games, simulation, or anything that involves problem solving. All of the following are strategies to teach diverse learners except A, allow ESL students to record lectures. B, providing different academic standards to students with disabilities. C, allowing ESL students more time to answer questions. D, calling students by their preferred pronoun. The answer is B, providing different academic standards to students with disabilities. Students with disabilities should be provided accommodation, however, they are still held to the same academic standards as the rest of the students. Which learning style prefers lectures? A, converger. B, assimilator. C, accommodator. D, diverger. The answer is B, assimilator. Assimilators combine abstract conceptualization and reflective observation. They understand large amounts of information by organizing it. They are interested in abstract ideas and concepts over people. Assimilators are good with inductive reasoning and value theory over practical application. They do well when they are able to reflect on what they learn and how they can apply it to past experiences. Their learning preference is lecture, one-on-one instruction, reading, and self-instruction. During a clinical rotation, a student almost gives the patient the wrong dose of insulin, but catches the error before giving it to the patient. When is the best time to provide constructive feedback? A, while the student is given the insulin. B, during debrief. C, later that afternoon. D, on their evaluation form at the end of the term. The answer is C, later that afternoon. Feedback should be given to students in a timely manner so that they can make changes as needed. All of the following learning styles prefer simulation except A, they all prefer simulation. B, converger. C, assimilator. D, accommodator. The answer is a simulator. They prefer lecture, one-on-one instruction, reading, and self-instruction. Which of the following would be considered the highest level on the cognitive domain? A. Define side effects of ACE inhibitors. B. Calculating the correct dosage of Tylenol for a 1-year-old. C. Developing a care plan for a patient with CHF. D. Assess the effects of insulin on a patient's blood glucose level. The answer is C, developing a care plan for a patient with CHF, because the other answers are lower levels of the cognitive domain. All of the following are ways for students to reflect on their practice except A. Group discussions, B. Clinical conferences, C. Journaling, D. NCLEX style questions. The answer is D. NCLEX style questions are a great way to assess the student's knowledge, but they do not allow the student to reflect on their practice. A student is struggling with IV insertion. What is the best response by the nurse educator? A. Provide coaching and practice in the skills lab. B. Fail the student. C. Have the student reflect on their strengths and weaknesses. D. Have the student write a paper on IV insertion. The answer is A. Provide coaching and practice in the skills lab. This skill requires the psychomotor domain, so practicing the skill is the most beneficial. For this presentation, I used Chapter 2 of Caputi. In the next presentation, I will continue to review practice questions for Domain 2.